Ready, Pam?
I'd like to call this meeting of the Central Nevada Health District to order. Is there anybody on the line?
Yes, we have Cassie and Denise online.
Okay, great. Thank you. Welcome. At this time, we'd like to stand and pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We'll go to item 3, roll call. If we could take roll, please.
Chair Tedford,
Here.
Vice Chair Cassie Hall,
Here.
Jim Barbie, Shannon Ernst, Dr. Justin Heath,
Here.
Bob Erickson, Denise Ferguson,
Here.
Tyson McBride,
Here.
Larry Rackley,
Here.
Jeb Rowley, and Rich McKay.
Okay, thank you. Item 4 is for public comments, which must be general in nature, not relative to any item on the agenda today. Discussion can be held. No decision could be made. There's another public comment towards the end at item 14. Is there any public comment today? Being none, we'll go to item 5, verification and posting of the agenda.
Pam Moore, for the record, the agenda was posted on October 19th between the hours of 3 and 5 at the locations listed on the agenda in accordance with statutes.
Okay, thank you. Item 6 is approval of the agenda as submitted. Do I have a motion to approve the agenda?
I move to approve the agenda as submitted.
We have a motion. Do we have a second?
I second. Tyson McBride.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries and the agenda has been approved. We'll go to item 7, approval of the minutes for the September 14th, 2023 board meeting. Do we have a motion to approve those minutes?
Justin Heath, for the record, I motion to approve the regular minutes from the September 14, 2023 board meeting.
Larry Rackley for the record, and I second that motion.
We have a motion and a second to approve the minutes of the September 14th board meeting. All in favor?
Aye.
None opposed? The motion carries. And the minutes for that board meeting on September 14th have been approved. We'll go to item 8A. Item 8A is consideration and possible action on approval of the agreement between the bank card merchant of WorldPay and the Central Nevada Health District, which allows holders of credit cards to purchase services based on the amount set forth in the merchant price schedule.
Mr.
Darren
Chairman,
or Amber, who's going to handle that? You
Yeah.
going to handle that?
Yeah.
Okay.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this allows for each of our locations to have a point of payment system, just like you'd see in anywhere you go to put your credit card in, allows for our clients that come into the clinics and into the environmental health side to pay for services. We, I guess, several months back, decided to go with WorldPay, and this is bringing that forward to allow for that system to be installed within each of our locations.
Okay, are there any questions from the public or from the board of Darren on this agenda item? If not, I'd entertain a motion to approve it.
Justin Heath, for the record, I move to approve the agreement between Bank Card Merchant of WorldPay and the Central Nevada Health District, which allows holders of credit cards to purchase services based on the amount set forth in the merchant's price schedule.
We have a motion. Do we have a second?
Jeb Rowley for the record, and second this motion.
We have a motion and a second. All in favor?
Aye.
Opposed? None opposed. The motion carries and that item has been approved. We'll go to 8B, consideration and possible action on ratification of a partnership agreement with Celco Partnership, DBA Verizon Wireless and Central Nevada Health District to obtain state vendor pricing. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is allowing us to enter into a participating addendum with the state of Nevada for Verizon wireless services. Basically, we can buy some of their services, wireless software, other services under this agreement. Allows for that state pricing.
Okay, any questions of the public or the board for Darren on this agenda item? Being none, I'd entertain a motion.
Larry Rackley for the record. I make a motion to approve the ratification of partnership agreement with Celco Partnership, doing business as Verizon Wireless and the Central Nevada Health District to obtain state vendor pricing.
This is Kathy Hall, I second.
We have a motion and we have a second. Did you get that okay on the? Okay, we have a motion and a second. All in favor?
Aye.
None opposed? Motion carries. And 8B has passed. We'll go to 8C, consideration and possible action concerning ratification of a sub-agreement between the State of Nevada Department of Public and Behavioral Health and Central Nevada Health District in the amount of $32,998 effective 10/1/23 to develop and implement services in Eureka, Churchill, Mineral, and Pershing counties related to chronic disease education, 10/1/2023 through 9/30/24. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is an award, as stated there, for $32,998 to really look at chronic disease within all of the district. Scope of work really is to look at data analysis for this, determine where our needs are, and so it'll allow us a little bit more leverage in terms of trying to figure out exactly where we should put our money's worth, I guess, for later on as we apply for different grants. We'll have a better idea of where to put some of that effort.
Okay, any questions of Darren from the public or from the board?
Hey, Darren, Jeb Rowley, just what kind of information could some of the counties or communities provide that would help you with making that informed decision?
Yeah, just really, we're going to be looking at some of the risk factors within each of those counties, because some of those risk factors are going to be different. And so we want to be able to develop those factors, and so we can have a targeted approach at kind of what we're doing. And I can't give you specifics really right now. As we look at those surveys and how we get those surveys out, we'll kind of see what makes sense and what we need to be looking for a little bit more as we dive into it.
Sure.
Dr. Ted McDonald for the record. Also in that, we do have some background information that has been accumulated from the state regarding each county. There's a scorecard that the state keeps track of our health for each county. And so that will be one of the sources of information we'll be looking at to get a baseline of where things have been. We also have communications with the people that develop that. So we do have some resources with the state that have been through this now for almost 10 years, I think, or more. They've been doing this report card, and we'll utilize that.
Okay, any other questions of the board?
Yes, this is Tyson McBride for the record. I'm just curious with the amount there, the 32,000, almost 33,000, is that used to, like, how is that utilized to collect that information?
Could you repeat that?
Yeah.
So with the money, nearly 33,000, how is that utilized to collect that information? What does that go towards exactly?
Most of that's going to be, if you look at, sorry, let me pull my paper back out. A lot of that will go to kind of the person who's working on it. We're not sure exactly who's going to have that, but salary for that, to develop those surveys, to get the assessments out there, collect all that data, then when it gets back, to analyze that data.
Okay, thank you.
Okay, if there's no questions, I'll entertain a motion.
Justin Heath for the record. I move to ratify the sub-agreement between the State of Nevada Department of Public and Behavioral Health and Central Nevada Health District in the amount of $32,998 effective 10/1/23, develop and implement services in Eureka, Churchill, Mineral, and Pershing counties related to chronic disease education from 10/1/2023 to September 30th, 2024.
Do we have a second?
Jeb Rowley, second that.
We have a motion and a second. All in favor?
Aye.
None opposed. 8C has passed. We'll go to 8D. Consideration and possible action concerning ratification of a sub-agreement between the State of Nevada Department of Public Behavioral Health and the Central Nevada Health District in the amount of $55,860 effective 10/1/23 to provide abstinence education for the youth. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Yeah, this is a grant that will help us to look at youth and abstinence education to youth, both targeting ages 10 to 19 years of age. Also, one of the goals is to prevent teen pregnancy and exposure to sexually transmitted diseases, along with maintaining and continuing to work with our community partners to educate the youth on sexual risk avoidance, self-regulation, goal setting, and healthy decision-making, with emphasizing a focus on a positive future.
Any questions on this agreement from the public or the board? If not, I'd entertain a motion to approve.
Justin Heath, for the record, motion to ratify sub-agreement between the State of Nevada Department of Public and Behavioral Health and Central Nevada Health District in the amount of $55,860 effective October 1st, 2023 to provide abstinence education for the youth.
We have a motion. Do we have a second?
Tyson McBride for the record, I second.
We have a motion and a second. All in favor?
Aye.
Opposed? None opposed. The agreement on 8D has been approved. We'll go to item 8E, consideration and possible action concerning a ratification of a contract for services between Partnership Douglas County and Central Nevada Health District to perform activities as outlined in the work plan as negotiated with the Nevada Tobacco Control Program to address tobacco prevention control through statewide identified programming in the amount of $10,000 for FY24. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this grant is to help us address eliminating exposure to secondhand smoke and promoting quitting among youth and young adults. If I can, real quickly, back the grant before this one, the abstinence grant, and this one, I'd like to say our team has been great. We have two team members that have stepped up to do this, both out of our Lovelock office. One is going to handle the youth abstinence grant, and the other person's going to handle this tobacco grant. And so I think they already have some tremendous ideas about how to do these. So it's another project for the district.
Okay, thank you. Any questions from the public or from the board for Darren? Okay, I'd entertain a motion.
Justin Heath, for the record, motion to ratify contract for services between Partnership Douglas County, PDC, and Central Nevada Health District to perform activities as outlined in the work plan as negotiated with the Nevada Tobacco Control Program to address tobacco prevention control through statewide identified programming in the amount of $10,000 for FY24.
For the record, Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed. This agreement has passed. We'll go to item 8F, consideration and possible action concerning approval of Resolution 27-2023, the establishment of Central Nevada Health District Petty Cash Account at $150 per location, not to exceed $600. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is to allow the district to establish a petty cash, $150 for each location. As you know, some of the clients and people we see within those locations like to pay in cash. This will allow us to make change when they do that.
Not sure how you've been doing this, but since we started, I don't know how you've been doing it. But anyway, any questions for the public or the board? If not, I'd entertain a motion to approve this.
Justin Heath, for the record, I move to approve Resolution 27-2023, the establishment of the Central Nevada Health District petty cash account at $150 per location, not to exceed $600.
Do we have a second?
Jeb Rowley, for the record, second.
Thank you. We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The motion carries to approve Resolution 27-2023. We'll go to 8G, consideration and possible action concerning ratification of a sub-agreement between the Division of Public and Behavioral Health Tuberculosis Program Office of the State Epidemiology and Central Nevada Health District for the amount of $84,189, effective 10/1/23 for substance prevention. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman, this grant is to help with our tuberculosis program, basically to focus on identifying, educating, and treating TB, and increase the capacity to screen and treat for TB-related conditions within our communities.
Okay, any questions of the public or the board on this particular agenda item? If not, I'd entertain a motion.
Justin Heath, for the record, I move to ratify sub-agreement between the Division of Public and Behavioral Health Tuberculosis Program Office of State Epidemiology and Central Nevada Health District for the amount of $84,189, effective October 1st, 2023, for substance prevention.
This is Tice McBride for the record. I second.
We have a motion and a second to approve this sub-agreement. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the sub-agreement on 8G has been approved. We'll go to item 8H, consideration and possible action concerning ratification of a sub-agreement between the Division of Public and Behavioral Health, Nevada State Immunization Program Office of the Bureau of Child, Family, and Community Wellness and the Central Nevada Health District for the amount of $42,528, effective on 9/1/23, for influenza vaccination for children. Darren?
Mr. Chairman, members of the board, this grant is to help with our influenza uptake and coverage among our targeted populations to decrease the burden of influenza on our healthcare system.
Any questions of the public or the board for Darren?
Jeb Rowley, for the record. Darren, how does this administer? Is this like the flu pods that continually go around, increased frequency of that? And how would that be scheduled? Or?
Correct. It's a part of that. This is a piece of that. There's a couple other grants we also utilize for that, but this is a piece of that. Doing the back-to-school events, pods, yeah.
Gotcha. Thank you.
Thank you. Any other questions? If not, I'll entertain a motion.
Justin Heath, for the record, I move to ratify sub-agreement between the Division of Public and Behavioral Health, Nevada State Immunization Program Office of Bureau of Child, Family, and Community Wellness and Central Nevada Health District for the amount of $42,528, effective on September 1st, 2023, for influenza vaccination for children.
And for the record, Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and the sub-agreement on 8H has been approved. We'll go to item 9A, consideration and possible action for approval of the FY24 first quarter fiscal report. Darren.
Mr. Chairman, members of the board, I believe for the record, Darren Winkleman, I believe this is the first time we've had a fiscal report on the actual agenda. We thought it was important to ensure you guys know as a board what we're up to and what we're spending and how that's going overall. This is certainly something we can look at as if this is not a good format. If you want to see something different, this is what we obtained from our Churchill County counterparts to help us understand where we're at. This looks at both July, August, and September, basically the first quarter. So if this is something you want to see each time, or we want to see in a different format, please let me know that this we thought was the first attempt. We try it this way.
Does the board have any questions? Would they like to see a different format? Is this format fine? Do you want to see it monthly? Do you want to see it quarterly? I think we're open to how you would really like to see this. And it's kind of early, so, maybe your thoughts might change from now and until we get into the future a little bit too. Because as you can tell, on today's agenda, we're still having money flow in that will change this report, readily. And so I don't know, Darren. I'm kind of ambivalent towards what it looks like now as to how we may want to see it. I usually like to see things monthly, but this thing's changing kind of dynamically, so I don't know whether quarterly might be okay for now, but I don't know how the board feels.
Yeah, Darren, I think this format's fine, and quarterly would be okay. And we can change it as needed.
Yeah, for the record, this is Denise Ferguson, and I think I agree with what was said in that right now there's just not enough going through right now where each month it probably doesn't have significant change where we're going to question, but maybe we could revisit in 6 months or something.
I think you should, if something flashes, I think we need to see it. If a red flag goes up or something, I think we need to be aware of that. But I think maybe quarterly's fine. I think the board's kind of echoing what I think.
Great, thank you.
So I need probably a motion to entertain this. Entertain a motion to approve this first quarterly report.
Justin Heath, for the record, I move to approve the FY24 fiscal report.
Tyson McBride for the record. I move to approve as well.
So we have a motion and a second to approve this first quarter fiscal report. All in favor?
Aye.
Aye.
None opposed? Motion carries, and this first quarter report is approved, mostly because it's just pretty free flowing here. So as we go, we'll probably take a longer look at the 6 month or 9 month period. Maybe the 9 month, 6 months is going to be right around the corner, so I don't. Okay, we'll go to 10A then, the The health officer report, that's consideration only. There's no action on this on the agenda. It's just your report, Dr. Ted.
Thank you very much, Mr. Chairman and Board. I've presented everything in the packet, and my job today is to be here and answer any questions you have.
Does anybody have any questions of Dr. McDonald on his report? Appreciate the report. Dr. McDonald is full as usual, and I appreciate that.
Dr. McDonald, this is Denise. I have just a question of more expertise, but, you know, people will ask us, do we think there'll be a COVID booster every year, kind of like flu? Do you have any thought on that?
Ted McDonald for the record. The general feeling is it's going to look a lot like the flu. Is they're going to be surveying it and watching it and determining, you know, what vaccine is the next and best for the next variety of COVID-19 virus we see. That's what I'm seeing, and there's a lot of the reasons for it. There's still a lot of morbidity and mortality behind the disease, even though the numbers aren't as great. It's acting like the flu now, where the numbers of affected individuals are still increased over what goes on in the normal population that doesn't get the flu or has or just has a common cold. And because the people that are most affected are the elderly and the young and those that are immune compromised, society is going to lean towards helping those disadvantaged populations or protected populations that we currently recognize in our society.
Thank you. Appreciate that input.
Okay, any other questions? Okay, thank you. We'll go to item 11, the administrator report. There's no action here either, but Darren, your report?
Yeah, Mr. Chairman, your report is in your packet, and be happy to answer any questions that I can on that.
Any questions of Darren on his report? We thank you for it too, for submitting it.
Darren, Justin Heath for the record. Is this it for the flu pods, or are we going to be done after October 26th?
Sorry, Dr. Heath, can you repeat that again?
Are we done with the flu pods by October 26th? That's the last one listed in the report.
For the most part, the pods, yes. We do have some leftover influenza vaccine that we're going to be administering. We're reaching out to our community partners to see who needs that. I think we're going to work with the high school, is that true, on that, and some other community organizations to see if we can help out with that, what we have left.
Okay. Are you done with all your shipments? Is this it?
I believe so, yeah.
Darren, why don't you just tell us how it's going?
That's a great question, Mr. Chairman, members of the board. For the record, Darren Winkleman. I guess I'm biased, but I think it's going pretty well. Certainly, we, I think, are finally getting our feet underneath us in terms of understanding what some of the grants that came prior to us have to do with, and what we have scope of work-wise to do. So we're feeling a little bit more comfortable. As I said earlier, we're now kind of taking some of those scopes of work and giving them out to certain team members and allowing them to work on those grants. And so now we're just getting that traction that I think we're kind of spinning our wheels in the beginning. We have some great relationships now with our community partners, both locally and at the state level, which is really good, and reaching out to those when we had, questions about those grants or how we need to move forward on a particular issue. So overall, it's going well. We got a lot of work ahead of us. We are fortunate enough, we made an offer to a new environmental health manager, and she accepted. We'll be starting mid-November. We also have made an offer to an epidemiologist who will be beginning, hope if everything goes well, will be start to the end of November. And we're fortunate on both of those. We took We stole them, I guess, one from the state, one from a local entity, and the epidemiologist comes with a phenomenal background and is just a game changer for the district. And so we're excited about that. That'll just help us move even light years faster in some of the things we're doing. So things are going well.
Do you have a timeline into your new building?
I think Shannon and I were going to start a pool here and see who can win. Shannon thinks we're going to be in maybe early summer, midsummer. I'm guessing late summer. It's kind of where I'm at. But
Okay.
with a building as old as that one is, and excited to be in kind of a historic building like that, but you start tearing into walls and you have no idea what's behind them. So that'll kind of dictate, I think, how fast we move forward.
Thank you. Okay, we'll go to item 12, consideration of anything, any future items on the agenda. Does anybody have anything they'd like to put on the next agenda? If not, we'll go to consideration and scheduling future meeting and dates. Are we back on the second Thursday next time, or in December?
Mr. Chairman.
Or November, I mean? What are we
yeah.
in? We're in October, right? November, I guess.
Yeah, Mr. Chairman, members of the board, that's one of the things I want to kind of maybe pick your brains a little bit about. Since we pushed this meeting so far into October, the next meeting will just be, I think, 2 weeks away. I had written down somewhere and I can't find it, which is a fast turnaround. Certainly, we're more than welcome. We can do that for you. However, we may want to think about pushing the meeting out into either the December meeting or even further into the January meeting. Totally up to the board. We'll do whatever you wish, but
Well, I wouldn't push it into January because that's too far.
okay.
I mean, that'd be 2.5 months.
We could certainly do the December
Be
meeting.
almost-
That's doable. We could do both meetings November. I just didn't want to burden
Well, I
you with
think
a quick
I can
turnaround.
see the November one because that's like 3 weeks away. And you're 2.5 weeks.
Darren, are you looking at the second Thursday? That would be the 14th, if that's what you're looking at.
Yeah, correct, ma'am. Thank you.
Yeah, that's probably a good idea, to not do November. I think everybody has a second Thursday on their schedule probably set. So if we did November again in a month, we're back to this. Everybody has to start resetting their schedules. So I think if we skip November, it's probably a really good idea to skip November and then just do December. But I don't think it's a good idea to skip December because. So I'm for this December 14th. At 1:30. I mean, if you don't have anything by December 14th, that's okay too. Then we can just notify the board that, hey, there's not a lot on the agenda, but I think we set up for that day. Okay, that sounds good. Item 14, public comment. General in nature, not relative to anything on the agenda today. Discussion can be held, no decision can be made, but discussion. If anybody, public comment. Being no public comment, go to item 15. We stand adjourned. Thank you very much.